Vaccination does not affect fertility. Getting COVID may affect male fertility, says new study. A new study adds to the growing body of evidence indicating there is no link between COVID-19 vaccines and a lower likelihood of getting pregnant, the CNBC reported. The National Institutes of Health-funded study, which was published on Thursday in the American Journal of Epidemiology, followed almost 2,100 women and some of their partners in the United States and Canada for about a year, finishing in November 2021. It concluded that getting vaccinated against COVID had no discernible influence on fertility rates in men or women. In comparison to males who had not tested positive for COVID within 60 days of their partner's menstrual cycle, men who tested positive for COVID within 60 days of their partner's menstrual cycle were 18% less likely to conceive during that cycle. More study is needed to figure out why male fertility declines following infection with COVID. Fever is a typical COVID symptom, and fevers are known to temporarily lower sperm count and motility, according to the National Institutes of Health. Dr. Bobak Durukim, director of male fertility and microsurgery at Lenox Hill Hospital in New York City, says that men who had symptomatic COVID with high fever may notice a temporary drop in sperm count that will likely rebound after a few months. COVID infections have now been demonstrated in multiple trials to impact male fertility, primarily in patients who are moderately to severely unwell, she adds. The NIH-funded study found that getting vaccinated against COVID could potentially prevent the short-term reduction in male fertility. Wesselink expects the findings will aid couples in making educated decisions about COVID vaccinations and provide reassurance that getting vaccinated will not affect their chances of becoming pregnant. From December 2020 to November 2021, researchers collected data from over 2,100 women in the United States and Canada, ranging in age from 21 to 45. Subjects were required to fill out health questionnaires online every 8 weeks until they became pregnant, or for a year if they did not become pregnant. Participants were also asked questions about their male companions, with the option of inviting them to fill out similar surveys.